Perfect. So microdermabrasion is a physical exfoliator. You can do microdermabrasion with either diamond tip, which is much more common these days than the alternative, which is crystal. It'll be either diamond tip or crystals that you come in contact with. There's now the aquadermabrasion, which the brand name of this is the hydrofacial. All of those use suction combined with a manual exfoliation, whether that's a granule or a crystal. And in the case of the aquadermabrasion, you are using water to actually infuse products into the skin. But microdermabrasion, aquadermabrasion, they do two functions: either manually exfoliate with the diamond tip or the crystals, or push serums, hydration into the skin in the case of aquadermabrasion. So that's the first benefit. And then the second is the vacuum suction actually vacuums impactions and issue from the skin while also stimulating the skin via the suction. So microdermabrasion is really twofold. The type of treatment machines that you're going to come in contact with are diamond tip or non-crystal, crystal, which is using an actual granulated crystal powder, and the aquadermabrasion. So you've got a few options when it comes to microdermabrasion, but essentially the goals are pretty much the exact same. The only difference is regular microdermabrasion is a exfoliator with the suction and the diamond or crystal tip, whereas the aquadermabrasion exfoliates with the suction, but it also pushes product into the skin. Fun fact, the hydrofacial is actually really nice, but it's quality wise, it's really not that much different than a basic aquadermabrasion machine. The only difference is you are not using their skin specific ampules, but it is much more cost effective. If you really like the hydrodermabrasion, the aquadermabrasion, if you like hydrofacial, it is a great brand to work with to have in your facility. It's a much more expensive price point. It's, if you can afford it, go for it. It's definitely going to pull in clients. It's expensive, but it is worth it. While you're getting started, if you're trying to determine if that's for you, the other brand, the off-brand machines are going to provide the same functions. There's suction and creating water and pushing water or serums or ampules into the skin. So it's going to it's going to be the same process. It's just a matter of branding at that point. The contraindication: anyone with rosacea, advanced stages of rosacea, current bacterial infections, viral infections, fungal skin infections, open lesions, burns, sunburns, or rashes in the area that you're microderming, dermatitis, eczema, psoriasis, inflamed or pustular acne. If someone has a grade 2 or higher of acne, you're going to avoid microderm or aquadermabrasion. Use of Accutane within the last 6 to 12 months. So I'm going to caveat that to say 6 to 12, because depending on how long they used it, how strong of a product they use, if they're using other products as well that strip the skin or compromise the skin's barrier function, then you want to have a little bit of a range. Typically for me, 6 months, and we'll do a patch test. If they haven't been off of it longer than 6 months, I don't even look at them. If they've been off of it, 8 to 12, then we'll go for the products. Recent plastic surgeries in the area, or we're going over aquadermabrasion separately? Yes, because we have to do the water. Recent plastic surgeries on the face or neck or anywhere that would impact them laying down. Recent dermal filler injections on the face or neck. I would say 10 to 14 days when it comes to the dermal fillers. Pregnant clients or patients, check with the manufacturer for sure, but I would avoid clients that are pregnant until they're done breastfeeding. And then skin may be more sensitive or prone to post-inflammatory hyperpigmentation during pregnancy, so you want to avoid that form of exfoliation. The benefit to this is that you are going to use the same setup as a basic facial. You're not adding much unless you're using a crystal microderm machine, you really don't need much, because you would, with the diamond tip, it's a wand. So you already have it. With the crystals, then you do have to have crystals, but other than the machine itself, you're not bringing anything new to the treatment. So same as a basic facial. The products, same thing, skin appropriate products, equipment, you're gonna want the microderm or the aquadermabrasion machine. The thing about the equipment is you wanna make sure it's in good working order. You wanna make sure that the suction is controllable and it has a varying degree of suction. If you get a machine and the suction goes from 0 to 1,000, it's not gonna work for you, because you're gonna over stimulate the skin. You're gonna create hickeys or bruises in the skin, so you don't want that. And then for the rest of the station, basic facial. When you're doing microderm or even aquadermabrasion, you are really just replacing the exfoliation step. In the case of an aquadermabrasion, the way I would go about it is I would do like a light chemical peel type exfoliant. So a light glycolic, a light salicylic, and then I would use that aquadermabrasion for product infusion. So serum infusion, oxygen infusion. And then for a regular microdermabrasion, diamond tip or crystal, you are replacing your actual exfoliation. So instead of using the exfoliating powder, you would be using the microdermabrasion machine. Does that make sense to everyone?
Yes, so basically we're gonna do the first segment again, like the cleansing, and then instead of doing the exfoliation, we're gonna use the microdermabrasion machine, if that's what we have.
Correct.
Okay.
Diamond tip crystal, diamond tip crystal, aqua exfoliator in place. And then let's just put the steps here because we already have them. So we're going to put on our gloves like we would in any exfoliation process. We're going to apply our eye pads for added protection. We're then going to perform our passes. You're going to perform 2 passes on the client's patient's forehead, checking for sensitivity. Ask the client patient on a scale of 1 to 10, 1 being light sensitivity, 10 being tolerable. So the way I like to do this, after we've applied the iPads, I'm going to set up my machine. Just like I did with the other device, the galvanic. I'm going to set up my machine off to the side. I'm going to turn it on. Put the suction 1, raise suction, and test glove. Once the suction is appropriate, I'm going to turn the machine off and bring wand. Once I'm ready, I'm going to prepare my passes. So I'm going to do my 2 passes. You can do 3 passes total. So we're going to do a pass, 2 passes, but the first pass is going to be horizontal. The second pass is going to be vertical. You can work the full face, or you can work the area in both by doing both passes. So I can do 1 pass all over vertical and then 1 pass all over horizontal, or I can do 1 pass forehead vertical, 1 pass forehead horizontal, move to the next section, move to the next section, move to the next section. After that, you can do a 3rd pass. That is going to be your spot treatment. Let's put a note here. After 2 passes, texture. any texture remains, you want to spot treat it with a third pass, and then the third pass is the next spot treatment. And then from there, if you're using crystals, you're going to wipe them. If I'm using a diamond tip, that is not diamond. If I'm using a diamond tip, I like to go over the skin with a 4x4 and product just to get a good look of it, to make sure that there's no missed spots, to make sure that there are no lines in the client's skin. If there's anything that I'm going to need to put a balm or a serum on, if I'm going to need to ice an area, then I'm going to check it for that. So if using diamond tip, I use a wet 4x4. Wipe the area just to kind of get a good look at the skin without the lines or the pattern on it. So what I want to show you is the actual grid. That you can use for microderm. All right, so do you see how on here for the Calendly book, you have your direction 1, direction 2, direction 3, and then you've got a spot treatment pass. Once you've gotten to an advanced level, or this is not the client's first time, you can go in with a third pass. So max of 3 passes. After each pass, check for texture. You can spot treat with the third pass, or you can do a diagonal third pass. Oh, that's not diagonal. Or you can do a diagonal third pass. So it is going to really depend on the client's skin type and skin condition if you do 2 passes and a spot pass, or 3 passes and a spot pass. If someone has oily, thick skin and a lot of texture, but they're not red after their second pass. So you've done vertical, you've done horizontal, they're not red, there's still some patchiness. Would I go in and do a vertical pass? Absolutely. I mean, a diagonal pass? Yes, I would do a third diagonal pass, no problem. If I have a client that's older maybe, and they have thinner skin, they've gotten really red, their skin is warmer, their skin is obviously, has been sensitized by the exfoliation, I might do a spot treatment and I'm going to move on from there. It is 100% up to you as the esthetician to check that skin as you're working through. You don't have to do 3 passes. You don't have to do 1 pass. You could do just a spot pass. It's all client dependent. That's what makes this upgrade custom to the client, right? They're paying for customization at this point. Yes, they're exchanging their exfoliator, but they're getting a stronger and a more effective exfoliator, allowing you to have more control and topically remove that dead skin. What can help us decide when to use microdermabrasion machine versus manual exfoliation? Like if I don't have the machine yet, can I achieve the same goal with manual exfoliation? No, you cannot achieve the same goal, and here's why. Manual exfoliation is removing the top layer of dead skin through physical exfoliate, like physical scrubbing, right? The diamond tip is doing the physical part. So the diamond tip and the enzyme powder exfoliation, both of them manually exfoliate. But what the microdermabrasion has that the manual exfoliate doesn't have is the suction. So that suction is helping pull dirt, debris, sebum out of acne lesions out of the follicle while you're doing that exfoliation. So it is not as simple as a manual exfoliation because you're adding the benefit of the suction. That's why it's technically an upgrade and not a basic facial. Also, because it's not safe for every person, you couldn't consider it the same as a manual exfoliation. Does that answer your question, Rosa?
Yes, thank you so much. Yes.
You're welcome. You can do a manual exfoliator and microderm. So when I was working, I did a dermaplane and a microderm. Why? Because well, actually, that's not true. I did a chemical peel and a microderm. So I'm going to chemical peel the skin with a light chemical peel if they're trying to treat, pigmentation or light acne. I might go in with a glycolic or a salicylic, allow that to take off that top layer of dead skin, and then neutralize the pill. Go in with the microderm, like a diamond tip microderm, allow that suction to help simulate cellular turnover even more and get any areas of the skin that the peel did not get all of the top layer of dead skin from the epidermis. So I've done microderm as a double exfoliator. I've done microderm in place of simply a manual exfoliator. I've done microderm in the case of someone needing a deeper exfoliation, but they can't handle a chemical peel, or it's summer and it's not appropriate to do a chemical peel. I can do microdermabrasion and nano needling for product infusion. Microdermabrasion is a step above a manual or a chemical exfoliant, depending on the chemical, of course, but you can customize the use of microderm to benefit your client. To answer the first part of your question, Rosa, the way you're going to know is based on what kind of texture you're dealing with and what's causing the texture. So in my opinion, it's best to do a microderm over a manual exfoliator when the client has thick, coarse, textured skin. Anybody with thin skin or anybody who gets red or irritated easily or sensitive skin, I'm going to do a manual exfoliator. I might even do a very light chemical peel because it's less harsh. But with a client who has oilier skin, thicker skin, coarser skin, they've got more texture, a microderm is going to allow the suction to help remove some of that oiliness and any congestion in the follicle, while also manually exfoliating them with the diamond tip. So physically running over the surface of that skin and allowing the diamond tip to create those micro tears. Controlled, of course, controlled wound healing is what we're doing, and allow the client's skin to be smoothed out that way. That's how I would determine if I'm going to use microderm or if I'm going to use another type of exfoliant. Does anybody else have a question on microderm? When you would use it, when you wouldn't want to use it? Everyone comfortable with microderm?
And this step, Ms. Claire, will be the same, right? We will add this into our facial, like the time, it will be also incorporated within the exfoliation time that we
Yes.
have. Okay.
Yes. So here's the thing. You can do one of two things with your business. You can do basic facials and advanced facials. So a basic facial can be 50 minutes and include the normal segments. And then an advanced facial can be 50 minutes and include galvanic, derma rolling or dermaplaning, nano needling, eye treatments, microderm, aquadermabrasion, extra massage, right? Or you can do basic facials that are 50 minutes and basic facials that are 75 or 90 minutes. They still include the same steps. You just give more time to do those steps. You can do basic advanced facials that you have advanced facials that are 50 minutes and include one additional modality like galvanic, or you can do advanced facials that are 75 or 90 minutes and include galvanic and high frequency, or microderm and galvanic and high frequency, but you've added more time as well. So it's really not a a one-size-fit-all solution. You can do your upgrades and add time, or you can do your upgrades and not add time. In the case of a microderm, you don't technically have to add time to do a microderm because it would take place of your regular exfoliator. But if I know that I want to do microderm and nano needling, I might need an extra 15 minutes. So instead of a 60-minute facial, I'm going to do a 75-minute facial.
Miss Claire,
Mhm.
nano needling, is that something we go over at some point?
It depends on who you are and when you started. So it was added to the course. If it was added to the course, and their price is different than the original price. So if it's not in your course, you can get it separately. If it is
Oh,
in your
okay.
course, you'll go over it at the end of your modalities. Yes.
Okay, so that's
Like the-
something a non-medical esthetician can do. For some reason, I
Absolutely.
thought we
Now-
couldn't. Okay,
you can do it under a doctor's supervision for microneedling. So I'm going to teach you how to do nano needling and microneedling, which are the same thing. You're just using a different head. In your esthetician room, you can do nano needling without a medical director, without a medical license. If
Okay.
you want to upgrade and do microneedling, it's the same skill, but you would need a medical director or you would need to work in a med spa.
okay, thank you.
You're welcome. Any more questions on microderm? Who here has done a microderm as a level 2? If you're a level 1, you're gonna get it, it's coming. If you're a level 2 and you've never done a microderm, let me know.
I've never done one.
You've never done a microderm. Okay.
No.
So
I've never done one either.
never done one either. Okay, let's talk through it a little more like step by step. So you've done your first segment, you've done your cleansing segment. Now we're ready to exfoliate. In this point, we're going to do microderm as opposed to the enzyme powder exfoliant or chemical peel. So we're going to put on our gloves. We're going to apply our eye pads for added protection. We're going to bring over our light. On our client. We're going to bring over our light. Girl. We're going to run over our client. We're going to set up the machine off to the side. We're going to turn it on, put the suction to 1. Raise the suction and test on the gloved hand, turn the machine off and bring the wand to client. Why can't I spell warm? Oh, different word, how about that? Bring the wand to client. We're going to perform our passes. But what we're going to do, the way we perform those passes, let's write that down. How to perform. To perform a microderm pass, we're going to hold the client's skin taut between 2 fingers. No, that's not what I need. I want to show it to you. Images. Perfect example. See how she's got 1 finger here, 1 finger here. She's got her wand and she is holding the skin taut and working horizontal, vertical, or diagonal, depending on the pass. So she's holding the client's skin taut between 2 fingers, placing the wand head on the client's skin. You want to make sure you're not applying excess pressure. I'm not pushing the wand down. I'm just sitting it on top of the skin, allowing the suction to do the work. And then once I've got contact, I am going to slide it across the client's skin to the other finger. So I'm going to slide from one finger to the other in my taunt. Oh, I didn't need to capitalize that. Oh, okay. Well, guess I'm gonna have to redo that. From one finger to the other. With my top section, so I'm holding it tight. I'm sliding from one end of my section to the end. Once I get to the end, of the section, I'm going to lift half of the head off of the client's skin to break contact. So once I get to the end of the section, I will lift break contact. So I'm going to see if I can find a video example of that while we're here. No thanks. No video, no sound. If I can't find an example of her lifting it off, then I will show you an example.
Doesn't hurt at all. It's literally like a...
No, she's not lifting it off. Don't like that.
Hello everyone and welcome.
We get to actual YouTube. There we go. There's no volume. Okay, hold on. All right, so it's kind of hard to see, but I'm gonna take it back just another second or so. And when it goes down between the eyebrows, I want you to see how she slightly lifts one piece of the wand to actually break the suction and remove it from the skin. So she's not holding taut between two fingers, that's fine. She's still holding the skin taut. Do you see her pinky finger? That's holding that skin taut. You don't want the skin to move with you. So she put it down, she got her suction, there she is. And then slight lift of the wand once she's done with the pass to break the contact with the skin. You're going to do your passes 3 to 4 passes max. Whether that third or fourth pass is a spot treatment is up to the client's skin. The first pass can be in one section, vertical, and then the next section vertical, the next section vertical, the next section all the way around the face. Or you can do one section vertical, horizontal, diagonal, next section vertical, horizontal, diagonal, section vertical, horizontal, diagonal, the skin off, dry the skin, check for any patches or spots, and then do a spot treatment if the clients can take it. I'm also going to put a note on here that the client's skin should be completely dry. So in our prep the client skin section, you can prep the client's skin with a de-encrustation gel, a scaling fluid, a light chemical, a light acid application. You can use alcohol, you can use toner, you could like a astringent type toner, like is it Dr. Myers, a witch hazel, or you can use just a dry 4x4. oilier the client's skin, the more I'm going to put into prepping it. So let's put on here alcohol, acetone, dry 4x4, white acid application. And then you can also use, which is to prep the client's skin. So once I've applied those products and I've stripped the skin of its fatty surface, it'll allow the microderm to be a little more effective as well. Once I've done my passes, then I'm able to take that off, clean that off, check it, do a spot treatment or third or fourth pass, depending on how many times you've gone. And then from there, move on to the next segment, which is, this is our exfoliation. So we're going to move on to extractions. When you get into the building tomorrow, if you're coming into the facility, I would absolutely recommend you go ahead and do a microderm. If you're doing a chemical if you're doing a basic facial, all you're doing is switching out the exfoliation portion. So as long as you're comfortable with the exfoliation portion, have one of the instructors help you make sure the machine is set up, show you how to check the suction, and then do a couple of passes on your gloved hand. If you want to work on it on yourself, what I've had people do is, if you have a tattoo on a leg or an arm, clean it like you would a regular surface on the skin, and then practice over your tattoo so that you can see the difference after you've removed that top layer of dead skin using microderm. And that way you can feel what it feels like to use too little suction or too much suction. It's hard to kind of feel it here because you're not touching the machine. But as far as the step-by-step goes, you're putting on your gloves. This is to prep skin, so clean skin. You're putting on your gloves. You're applying the eye pads for added protection. You're bringing the light over. You're prepping the client's skin. By drying it completely, you can use alcohol. There we go. Alcohol, acetone, a dry 4x4 like acid application or witch hazel. You're going to set up your machine out to the side, turn it on, test your suction, raise your suction, test it on your gloved hand. Once it's set, turn the machine off. Perform your first 2 or 3 base passes, 1 vertical, 1 horizontal, 1 diagonal. You can perform those passes in that order on each section individually, or you can do the full face vertical, the full face horizontal, the full face diagonal. After that, we're going to do a cleanse of the skin using just water is fine. If you're using crystals, I would probably do a full cleanse to get the crystals off. And then I'm gonna do a spot treatment, a 3rd or 4th, which would be considered a 3rd or 4th pass, depending on the client's skin. And then cleansing again if necessary, removing any surface crystals or guidelines on the face that you've created. And then I'm moving on to the next step of the facial. We went over the contraindications. The only thing that you need that's different from a regular facial is the actual microdermabrasion machine itself. The only real problem that you can run into with microdermabrasion is not holding the skin tight, overworking the skin, or giving someone like a hickey because you weren't holding the skin tight. And really, those are your only 2 or 3 real issues that you can run into with microdermabrasion. So you always start with your suction low. You always start with the least amount of passes necessary to do the job for that client. Any more questions on microdermabrasion? We got a chat. No. Perfect. Okay, I'm going to stop the recording for microderm.